Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the legislature returns to a busy fall agenda. Senator Mike Brubaker is here to analyze, and then we continue our series on quality improvement in health care, Pennsylvania politics and government, in depth and in detail, and guess what? It all starts right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, the legislature is about to make its return. It has a huge fall agenda, not just in terms of the number of items, but the quality of them, the significance of them. Joining me is Senator Michael Brubaker. Mike Brubaker, he's a Republican. He represents a district in Lancaster County. Welcome, Senator.
It's great to be with you, Terry.
Well, let me tell you, you guys have your hands full, don't you? Now, you've been in a while. Is this a huge agenda? Big items, right?
This is my fifth year.
Fifth year
in the Pennsylvania General Assembly. I'm the chairman of the Finance Committee this time around. That's a big responsibility. And yes, we do have a full, robust calendar for this fall, and it's very, very important that a couple of these big initiatives get across the finish line.
Okay, let's start with one that we've talked about on this program before. Not arguable, Pennsylvania has huge infrastructure needs, roads and bridges, 7,000 miles of state roads in some form of disrepair need rebuilt, 25% of the bridges go on. And it takes money. Will you all pass something to fund these?
Well, I want to pass something to fund it.
Right.
No matter where you are in your fiscal conservative approach, we have to spend money on Pennsylvania infrastructure. You talk about 25% of the bridges. That's roughly between 5,000 and 6,000 bridges that are structurally deficient. And we know what it costs today to rebuild a bridge versus 10, 15, 20 years ago. A lot more money.
Right.
So there was a study done. I think the study is indisputable in its credibility, saying we need $3.5 billion to get our transportation up to where it ought to be. That's not building new roads. That's just repairing the mess that we have now. There was a commission that just finished up their work, and they found $2.5 billion of revenue. Not 3.5, but 2.5. That's
and that would be the license fees and registration fees, which haven't been increased for 10 years or so, and something called the oil franchise tax that gasoline that companies would pay. But
that's right. So bottom line, that's exactly right. They've coupled together a couple of different initiatives. Their mandate, when they met, was no long-term lease of the turnpike and no gas tax increase. So they were working under that mandate.
Right. And no tolling Route 80. That's sort of off the table now, right?
Well, it's been off, but there's some rumor that it might be coming back on. And if it comes back into the agenda, it's not just 80. We'd be looking at multiple roads throughout.
And the problem with 80 was the federal government and sort of the limits and the restrictions that would be placed on it and how the money could be used. You know, it only have to be used up on Route 80. Is that correct?
That's right. We messed up. We in the General Assembly, whoever was putting that document together, in my opinion, wasn't listening to the feedback we were getting, because I think we were denied 3 times by the federal government.
Yeah, I think
so. What we were doing, we were taking that I-80 toll money on paper in a plan and spending it elsewhere. And the Fed said, you got to spend it on 80.
Yeah, which wouldn't help some of the needs that you've identified that are around the state, right?
Well, what it would do, Terry, is take the money that we're planning to spend on 80 and free that money up for other projects.
How optimistic are you on this? I know it's tough right now to vote for any fee or taxes or whatever you want to call them, but it's a real need.
It is a real need. They put together this plan attempting to not deal with taxes, deal with fees, to attempt to meet the governor's pledge. So the executive branch is working cooperatively with the legislative branch. It's an initiative that we must accomplish.
All right,
now the question is the magnitude.
I want to go to another hot potato, and it's the sale of the liquor stores. Every poll done says voters, residents of the state, regardless of how you ask it, in favor of selling liquor stores. Very controversial. Been tried 4 times. 4 times. Bill out in the House with the majority leader, Mike Terzai, double the number of retail outlets, something like from 600 to 1,200. Some say it can't get out of your chamber. Now, you know more than I do. What's the prospect for passage, or talk about what you think needs to happen?
Well, there is a shot at getting Pennsylvania liquor stores privatized. It's not dead, in my opinion. And you're right. The proposal that Terzai has on the table takes 600 stores, goes to 1,250. 750 of those are in the big retailers, and then 500 small neighborhood liquor stores. Pennsylvanians generally want liquor to be controlled to a degree in how it's sold. There's a lot of control in Terry's plan. I'm personally open. I'm open to, I mean, I've been wrestling ever since I became a state senator. Should Pennsylvania, and I am part of Pennsylvania, leaders, I'm in the state government. Should I be, as a state senator, in the liquor business? And I think the answer is no.
Well, I asked Governor Corbett on here when, I think it was in the spring when he was on the program, and he said, you know, moral objection aside, he just doesn't think state government ought to be involved in it. It's just not a function of state government. As you know, 48 other states don't do it. One other state completely allows, you know, for the wholesale and the retail operations, as you know, to be run by the state. But every other state, some aspect of it is public.
My personal opinion, Governor Corbett's exactly right. Pennsylvania, a role of government is not to sell liquor. A role of government, in my opinion, is certainly to enforce liquor laws, make sure underage youth are not consuming. When they do, make sure we're coming down on the establishments that are selling to underage. We need to control it, but we're in the business and control, and that's a conflict of interest.
All right, natural gas. We're going to run to a break. We're going to ask the senator what's going to happen. Marcellus Shale, impact fee tax. Voters say, let's go ahead and do it. And by the way, don't be drilling on these anymore in these state forest lands. They want to protect the environment as well. We'll ask State Senator Mike Brubaker what he thinks about Marcellus Shale, natural gas, coming up.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by ReconnectPA.org, supporting a comprehensive transportation funding solution, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program with State Senator Mike Brubaker. He represents a district in Lancaster County. We're talking about the fall agenda of the legislature, busy, crowded, lots of big items. And I guess, Senator, none are more important than this whole business of natural gas in the Marcellus Shale, the drilling. It's complicated. Talk about what you think is likely to happen. Big question. Will there be an impact fee? I got you on that one, didn't I?
Tough question after tough question, and rightfully so. We're in times where we need to be addressing the big issues.
Are you open to the question of an impact fee that will stay in the local community?
Answer is yes. Matter of fact, I've co-signed one of the bills. There's multiple bills that are on the table. I've co-signed at least one. Marcellus Shale is the biggest economic boon to Pennsylvania, some people say, in the entire history of the Commonwealth. We have well over 1,000 holes in the ground. $8 billion, Terry, has transferred from the companies to Pennsylvania landowners. And of course, a lot of these companies are paying taxes. We have a very high tax rate in Pennsylvania. But what we don't have on the industry is an extraction tax. So Joe Scarnati's bill, which is Senate Bill 1100, calls it
President Pro Tem of the Senate. Go ahead. Just help me out.
Thank you. Calls it a fee. And some people say he threaded the needle was the terminology that they used, attempting to make sure that he's not in violation of the governor's no tax pledge. So I don't know that the governor's made it clear yet what he thinks of Scarnati's 1100, but that one has a shot.
I think he did say he was open. He's reviewing the report of his own commission that did recommend the impact fee, right?
That is accurate.
Yeah, now let me go one step further. Look, you represent a district, large agricultural district. You've been very concerned about the Chesapeake Bay and the cleanup. And you've expressed some concerns about the environmental considerations. Go, say something about that.
Yes. I'm pro-drilling. I think that we need to extract natural gas in Pennsylvania. But I don't want to do it haphazardly, and I don't want to do it as an adverse effect to the environment. So I want to make sure that our DEP Secretary, Mike Krancer, is on top of this. And he's proven to me he is. I want additional personnel working for DEP on those sites. I want to make sure MSDS sheets, material safety data sheets, are there so that the citizens know what chemicals are going down into their substrate. So we've done all that. I want to make sure that we have the highest frac recycling percentage in the country. We have that today. So we're doing a lot well Can we improve our environmental performance? Yes. Are we, in my opinion, the top environmental performer in fracking? I think we are.
All right, before I let you go, the Senate Finance Committee, you chair, and I know there's been this ongoing debate about pensions, state pensions for state employees as well as school employees. Any plans out of your committee to deal with pensions, which keep coming up? Now, they did put a fix in a couple of years ago.
Did put a fix in, Terry, but the fix, and I applaud the fix. Thank you for the fix, for the leaders that worked on that deal. But it made very little impact in the unfunded liabilities that we have. Terry, our pension, what the state pays, next year, we're going to have to pay the state $500 million more. The year after that, $1.2 billion more. The year after that, $1.9 billion more than what we're currently paying now. The question that I ask taxpayers all the time, in your opinion, is our pension system economically viable? I've come to the conclusion it's not. We need to make some structural changes. So toward that end, I've not announced it yet, but I'd like to announce it here. As a chairman of the Finance Committee, of which these changes would emerge, we're going to go around the state and we're going to listen to Pennsylvanians. We want them to come with ideas. We want them to tell us what they think of our current pension system, what it is today, and what they, the investors of Pennsylvania, the taxpayers, what they believe it ought to be in the future.
Okay, well, in all, I always fess up that a former professor at Millersville, I'm in the state employees pension system. The senator is, you're in too, right?
That is correct.
Okay, we just get that all out, Look, you'll come back throughout the year and give us an update from time to time on what's going on?
I'll come back anytime you invite me.
Hey, thanks, Senator. Now we're going to continue our quality improvement series with our friends from Highmark. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, look, we're continuing our series of quality improvement programs, doing with healthcare, emphasis on hospitals and what's been done to improve the quality of their programs. Joining me is Deborah Donovan. She's the Director of Provider Strategy and Innovation at Highmark, and Dr. Kevin McKenna. He's the Surgical Director of Hospital Quality at Penn State Hershey Medical Center, and Andrew Bloschichak. I got that right?
You did.
See, there you go. My friend over here is the Senior Medical Director with Highmark. All right, I want to start with you, Doctor. Gains have been made, renewed emphasis on quality, concerns about procedures in hospitals and medical facilities in general. Make sure the quality's up. People don't, get sick and have problems because of things that occur in facilities. What's going on?
Well, over the past several years, I think we've had a renewed focus in general with some of these avoidable and preventable conditions that we see in hospitals. And I think we've made significant strides over the last several years, and part of the reason we have is because of partnerships with Highmark and other insurers that help us with supporting our efforts to reduce some of these conditions.
Yeah. Now, I noticed that folks at a variety of institutions are now really on board. I mean, this is now a focus of a lot of people, hospitals, physicians, surgical, almost everywhere you go. I mean, I just noticed as a patient, but talk about that a bit.
It's a national focus. I think in the late 2000s, the Institute of Medicine brought to forefront the numbers of Americans that died attributed to medical errors, and that was our rallying cry to do better. And so programs like Highmark's Quality Blue program really are working with our hospital partners. We have 80 hospitals in the program today, And the goal is to improve healthcare quality and safety and reduce those preventable errors and unnecessary mortalities.
Now, because of this we have this Pennsylvania Patient Safety Authority, is that what it's called?
Correct.
And that created a few years ago, and they sort of monitor. We talked about that last week. Is there something about that that's important that our viewers should know about that work and how it relates to what you do?
Sure. Interestingly, the Department of Health, as well as the PHC4, who I believe you've probably had on, they have published a report in the last year, 2 separate reports, but in each report, the hospital or healthcare acquired infections, those infections that a patient acquires during their hospital stay, the percentage is really not that bad. It's about 1.2% of the hospital admissions end up in this. But when you extrapolate that to the actual numbers, ends up being somewhere, just for Pennsylvania, somewhere 23,000, 24,000 patients.
Now, because of the work that's being done, would you expect that was lower? Was this being tracked before? Does anybody know?
Yeah, it's not been tracked as well. So
now it is.
It is now. There's increasing highlights of accountability in organizations, so I think the tracking is better, and the mechanisms to track. So a patient who leaves the hospital after surgery often develops an infection after they leave the hospital. Right. So there's better systems to gather that infection information post-discharge.
But it's your sense of this, that because of this, that the rates are lower than they would have been before? I mean, even if we didn't have hard data to show that?
Unquestionably. And I think that the fact that now these conditions are certainly on our radar screen to a greater degree. And there's increasing evidence in the literature about how to prevent many of these conditions. So we're much more focused on evidence-based medicine, best practices. I mean, these were terms that 10 years ago were not commonly used.
Yeah.
You know, Terry,
So,
the Quality Blue program actually does track those infections by facilities that are part of the program.
And I want to talk in the next segment specifically about what you do, but go ahead. I mean, I want to talk about the ways you implemented it.
Sure, but there's been, you know, there is data that shows sometimes 30% reduction in specific infections over year to year.
And we're going to run to break, but we also have patients. I mean, patients are much more involved in this than ever before. They know a lot more. Sometimes they think they know more than they do. I think you would agree with that.
Right.
But that's another element here, right?
Absolutely.
All right, when we come back, we're going to get into the details about how these programs have actually worked to reduce infections and other problems that can occur when we go and access the healthcare system.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back. Well, we're talking about quality improvement. This is the second in a series of them. I want to turn to you, Deborah. Let's talk a little bit. I mean, specifically, what does these programs like the one you have reduce, improve quality care and make patients feel more comfortable about the environment?
Well, I think it does help facilities follow guidelines. And so if we talk about blood clots, I'm sure you've heard about blood clots in your legs that can go to your lungs, high mortality. The Quality Blue program has an indicator that requires hospitals to work on reducing those healthcare associated clots from forming, and so Hershey has a great story of the work that they've done in reducing what occurs within the facility.
And that is?
Well, over the 3-year period that we've been participating in the Quality Blue program, a team of clinicians and non-clinicians was assembled at Hershey to address specifically this problem of VTE, or venous thromboembolism, just a fancy name for clots.
Got it.
Part of the reason for that was that VTEs were identified as the #1 most preventable cause of in-hospital deaths nationally. So in conjunction with the folks at Highmark, this program was developed, And as a result of that, over the past 3 years, we have reduced our rate of pulmonary embolus, which is the serious consequence of developing a clot, to 2/3 of what it had been when we started the program.
Now, the guidelines that he's talking about, are these, real specific about steps that you take, to prevent a particular problem, or you go work on it and we're going to monitor it, or we're going to not pay or whatever if it's not done properly? How's that work?
Excellent point. And the program is structured such that a percentage of the hospital payment is withheld, and that payment is made based on metrics from the program. And the metrics include measuring, because you don't know you have a problem unless you measure to see if you have a problem.
Right.
But also analyzing your processes, the steps that occur in the hospital. Also the outcomes. So it's not just the processes you follow, but the actual outcomes. Are you reducing the infections? And then lastly, it takes an element of patient satisfaction into it as well.
Okay, we got about a minute left, but tell me, where does this go? Where does this go?
We continue to raise the bar, so we continue to incorporate new indicators into the program in areas where we know hospitals are challenged and are struggling, and we look at it as collaborative. So we pull an indicator in and we work with our hospital partners on improvement, and the end result is patients receive better care.
Now, I get the sense from the Hospital Association, frequent guests, we talk a lot about policy, but that hospitals have really bought into this and actually are pretty enthusiastic in many cases about this.
Absolutely, and I think engendering that culture of quality and safety is critical. And I think the leadership at Penn State Hershey Medical Center has been able to support many of these efforts to allow us to make the gains that we have.
Yeah, 30 seconds. This program expand, grow. How big is it going to get?
I think it'll continue to grow. It's currently at 80 hospitals in the state. It started out about 10 years ago with just a handful. So far, the savings have been about $52 million in savings,
wow.
About 2,000 adverse events averted, and probably, if you extrapolate data, about 300 lives saved.
There you go. I have to confess, I'm covered by Highmark. I've been covered by, I won't go into how long, but I always try to, make sure that everybody understands up front. When we talk about pensions, I have to fess up. All right, as always, thanks for watching Pennsylvania Newsmakers. We'll see you next week, and by the way, stay healthy.